While our programs team has been out talking to young people directly, our advocacy team has been working to talk back to government, to the sector, and to other stakeholders to really shift the conditions that are keeping the youth mental health crisis in place. We know that youth mental health is about more than just getting young people access to services, but it's about actually preventing the things and conditions that cause this huge scale of crisis that we're seeing amongst young people and their mental health. So we want to shift this by shifting the determinants and the factors that are keeping mental health in place and that are causing mental ill health, from homelessness to climate change to the cost of living. This year, we have three main priorities. We have regional and rural and remote mental health. We have digital determinants of mental health, and we have prevention as kind of a broader underpinning focus. So in action, what does advocacy look like? What are we actually doing with our time? We've been focusing on a few things in the digital space. We've been really working hard following the social media minimum age ban, or the age ban that happened last year. We've been working really hard to follow up our advocacy in that space. We really believe that young people deserve access to safe online spaces. And so we're calling for the government to introduce a digital duty of care that is robust and ensures that safety is really put on platforms and not on young people. This is a really significant piece of reform. It could see digital spaces like social media being really held to account for safety. Everyone has the right to exist online in a way that is protective of their mental health and well-being, particularly young people. We are seeing really important and kind of big impacts of social media on mental health. So we would want to find the right balance between making sure young people are thriving online and thriving in their world and their spaces, and also not putting that burden or that ownership on young people. So we've been working really hard to advocate for that piece of work. And building off the work that our digital team does in those spaces to lend our expertise in back to the sector. For our focus on regional, rural and remote young people and mental health, we kicked off this April with a really cool event, a youth voice workshop attended by the Duke and Duchess of Sussex. It was an amazing opportunity to have young people in the room with such people in power, to have their voices heard and to just hear from them their perspectives of growing up in regional and rural communities. The young people spoke from their hearts about their kind of vision for their communities. They shared their experiences of a system where young people face pretty significant barriers to getting the mental health care they deserve. Long wait lists, really long drives to get to a nearest psychology or even GP clinic. They spoke about where young people have to kind of wait for a really significant event like a natural disaster to receive any kind of help or support. And they spoke really clearly about their kind of pride and passion for their communities as well, and the things that they love about living in regional and rural areas, and the importance that stigma plays for those communities. They really shared a lot about how the kind of tight-knit communities have a bit of a double-edged sword of being super protective and super amazing, but also carrying a bit of a kind of closed-mindedness or making stigma feel a little bit more present in those communities. So we're working hard to kind of implement back their perspectives into our policy work, to share that with government, to share that with stakeholders, and really try to shift the system so that it's a little bit more equal for people living in regional and rural places. And be informed by their lived experiences in everything we do from here on out. We believe that your mental health shouldn't be dictated by your postcode or where you live, and so we're doing everything we can to try to shift the system to be a little bit more equitable. Finally, batyr will continue our kind of ongoing efforts to really advocate for a stronger prevention sector. Only 1% of the current mental health budget actually goes towards prevention. And so that means that we have a mental health system that's really geared towards what we call late intervention, or the kind of hospital beds and clinicians that are really important, but won't actually shift the tide of the youth mental health system or crisis. So we're calling for a 5% investment into prevention of the overall mental health budget. We really want to see more going into prevention. We know that it's just so impactful. It's what we talk to young people all the time about, and that they say would make a real difference. We don't just want to be kind of stemming the tide of mental ill health. We want to be actually shifting the tide. We want to be addressing the kind of causal factors, getting in early, giving young people education, so that we actually see those rates of suicide and of mental health lessen instead of just kind of addressing it once it happens. We talk to young people all the time about, they kind of share a lot of reflections with us about feeling like they have to get worse before they can get any mental health support, or feeling like their health has to kind of decline for them to be kind of valid enough for services. And that's just not good enough to us. We're really advocating hard for a shift in the sector and in the kind of funding in particular. Prevention is a tricky space to be in. It's not super valued yet, but we're working hard to shift that and speaking to government all the time about the importance of prevention, the importance of really shifting the tide. You know, it just doesn't make a lot of sense to us to only have 1% of the overall mental health budget focused on the thing that will actually stop mental health. So yeah, we're working with our sector colleagues really hard on that piece, hoping to launch a bit of a campaign later in the year, and really leading into a few key pieces of kind of key reform moments towards the end of this year and then the budget next year. We really want to see this prioritised in the mental health sector. There's a lot of key moments up ahead of us. You know, in the next year or so, we've got a really big opportunity for kind of quite intense reform to the system, and a lot of our colleagues and ourselves have been calling for prevention and a focus on youth and child mental health for a really long time as a key factor in shifting away from a late intervention or crisis-driven system. So we're hoping to really make sure this is prioritised. You know, there's mental health and health ministers meeting in September, and then we have next year's budget to look forward to. So hopefully we really see a significant shift in the way that the funding and structure of the kind of mental health system is laid out towards more of a focus on prevention. We think that that would just change the game for young people, and it would change the game for an organisation like batyr, who really has to rely on a lot of outside of government funding to be able to exist. Unfortunately, there's not a huge appetite for prevention. It can be trickier to navigate that and to get the kind of care and attention that prevention really deserves in an environment where a lot of money goes towards kind of the beds and the announceables, like hospital beds and psychology, you know, placements and things like that. So we really want to see that shift. We're working hard on doing that. It's really critical to both our sustainability and really shifting genuinely the tide of youth suicide and youth mental health crisis in future. So really, really important one for us. Some other really cool work we've been doing. So last month I was in Canberra attending the Mental Health Australia Policy Forum. It's a really cool chance for us to align as a sector. We have representatives from like 90 other organisations working across mental health and kind of related spaces to really get together to share learnings, to come to the same kind of agreements and kind of policy priorities. So an amazing kind of collaborative piece of work happening there. We also are sitting as part of some critical kind of reform pieces happening in the mental health sector, sitting on an expert advisory group as part of the creation of the new youth mental health models of care. There's been some really big shifts in how headspaces are funded that we're a part of kind of guiding the design of that piece of work, which is a super exciting chance and hopefully will genuinely shift the services that are available to young people. In February, we also submitted to the inquiry into the relationship between domestic sexual family violence and suicide. We had some incredible interviews with a few of our lived experience storytellers, really heard their stories of navigating their own experiences with DFSV and suicide, and really got to hear from them what would have changed their experiences and their interaction with the system, and then got to feed that back to government. So that was an amazing piece of work and really exciting to be able to bring young people's lived experiences into our advocacy work. It's something we're super passionate about across batyr, but particularly in our advocacy. We really believe in nothing about us without us, and I feel really proud that we get to do work that is so well informed by young people's voices, and really grateful to the young people who helped inform that particular piece of work. It's such an important conversation for batyr to be a part of, so very, very grateful. As you've been able to see, our advocacy spans a lot of different topics. We know that young people view their mental health quite holistically, and our advocacy and policy work really reflects that kind of breadth and variety of topics. Underpinning it all is always a really deep commitment to young people's lived experience. We know that they are the experts in their own lives, and our advocacy really serves to have their voices heard in the rooms and tables where it really matters. We believe that if we listen to young people's voices and have them heard, we will fundamentally shift the youth mental health crisis currently facing Australia. While our